My name is Carter Stahl, and this is my speech to Persuade on donating blood. Hi everybody, my name is Carter Stahl, and I'm here today to persuade all of you to donate blood and save lives. Imagine your father needing surgery. Imagine your sister being diagnosed with leukemia. Imagine a friend in a car accident. Now imagine if there were no donated blood available to save the lives of these people. The blood loss in your father's surgery would prove fatal. Your sister's leukemia could never be treated, and your friend's loss of blood in the car accident would also be fatal. According to the Department of Health and Human Services, every year 4.5 million Americans will require a blood transfusion. It could be you, a family member, or a friend. Yet people still don't feel the need to donate blood because they think somebody else will. According to the Mayo Foundation for Medical Education and Research, only 5% of eligible donors across the United States donate blood. And of that 5% that do donate, less than 30% will ever donate again. During this presentation, I will talk to you about blood transfusions, who needs blood and who can donate, safety and fears associated with donating blood, the blood donation types, and the process itself. Starting off with blood transfusions, they preserve life and maintain health by replacing white or red blood cells. Blood transfusions also prevent long-term illnesses associated with blood loss. According to the 2007 Nationwide Blood Collection and Utilization Survey Report, someone needs blood every 2 seconds. Only 37% of the American public is eligible to donate blood, and less than 10% actually do donate. 3 lives can be saved with a single pint of blood, and 1 in 7 people admitted into the hospital will need a blood transfusion. If blood donations by Americans were increased by just 1%, blood shortages would disappear. Now that we know a little bit more about blood transfusions, we'll talk about who can donate and who needs blood. Starting off with the recipients, it's mostly surgery patients. Anyone getting a hip replacement would require 1 unit of blood. Anyone doing cardiac bypass surgery or a heart transplant would require 2 units of blood, while a liver transplant requires as much as 10 units of blood. Requirements of donors be that you're at least 16 years old, you need to be at least 110 pounds, and you must be healthy. Now that we know a little bit more about recipients and donors, we'll go on and talk about some safety and fears regarding blood donation. The Food and Drug Administration rules that blood transfusions cannot be purchased. Therefore, donors giving blood for patients cannot be paid. If donors give blood for research, they can be paid, but the blood cannot be given to a person. Keeping money out of this equation provides a safer blood supply. Some common fears associated with donating blood include fear of needles or pain, fear of a loss of strength, or fear of being at more of a risk for blood-borne pathogens. None of these fears are true. If you can withstand the pain of a needle going into your arm, that's all the pain you're going to feel. There's no loss of strength after the donation process, and you're at no more of a risk for blood-borne pathogens. Some fears about receiving donated blood are that the blood could be tainted or dirty. The blood goes through a series of 13 individual tests before it is ever given to a human. So now that we know a little bit more about the safety and fears of donating blood, we'll go on and talk about the types of donation and the donation process itself. Starting off with the whole blood donation, this is the most common donation and takes the least amount of time. All parts of the blood are collected in this donation. Your red blood cells, platelets, and your plasma make up your whole blood. And usually in a whole blood donation, a single unit is collected at a time. Next, going on to the double red cell donation. This is where whole blood is collected, but then it is sent through a cell separator, kind of like a centrifuge, where the separator just collects a measured amount of red blood cells and then sends back the platelets and plasma to your body mixed with the saline solution. And then there's also an apheresis donation. That's a lot like a red blood cell donation, where the whole blood is collected and then it goes through a cell separator, and in the apheresis donation either the platelets or plasma is kept and the red blood cells are sent back to your body. Now going on to the donation process, you start off with a quick medical history where they ask you questions about your personal life, the medication you're taking, your family medical history, and even where you've traveled in the past few years for precautionary reasons. After the medical history, you go on to take a quick physical where your blood pressure is taken, your heart rate, your body temperature, and even the amount of iron in your blood is checked. Once the donation is going on, you can either read, sleep, or watch a movie. This is why many people do like donating, because it is their one chance to relax throughout the day. And after the donation, it is recommended that you stay at the donation site for 15 minutes to unwind and enjoy a snack or a beverage, just to make sure you're totally capable of getting out of there on your own. So donating blood may be one of the most rewarding things you do in your life. During this presentation, I've gone through blood transfusions. I've also informed you as to why blood donations to patients remain donations, and also the common fears associated with blood donations. Finally, I discussed the different types of donations and the process of donating blood. We often say we'd do anything for our loved ones. Donating blood can potentially save a life of a family member, a friend, a complete stranger, or it can even save your own life one day. So donate blood and save lives. Thank you for your time.